I was, I'm not saying falling over a lot, but I was falling over more than usual, and my balance in the gym was very different. But then come November, I found out that I have the relapsing MS.
I had known of Tysabri just because I'd kind of started researching. That was part of my process of moving forward. I know that there is not a cure for my disease. What I know is that being on a medication like that is what is best for me in my life right now. People are always telling me that I'm a fighter because I've just always kept that smile on my face, and I've always kept a good attitude no matter what.
I'm often asked about being a fighter with my MS, and I don't think there's any other way that you can live with MS. You have to fight, you have to be an advocate, you have to be proactive in your care and your treatment when you're living with relapsing MS. It's something that we all have to be part of. So being a fighter and being my own advocate and fighting for what I need to have in my healthcare is something that being a fighter means to me.
Indication. Tysabri, natalizumab, is a prescription medicine used to treat adults with relapsing forms of multiple sclerosis, MS, to slow the worsening of symptoms common in people with MS, and to decrease the number of flare-ups, relapses. Tysabri increases the risk of progressive multifocal leukoencephalopathy, PML. When starting and continuing treatment with Tysabri, it is important to discuss with your doctor whether the expected benefit of Tysabri is enough to outweigh this risk. Important safety information. Tysabri increases your risk of getting a rare brain infection, called progressive multifocal leukoencephalopathy, PML, that usually leads to death or severe disability. There is no known treatment, prevention, or cure for PML. You should not take certain medicines that weaken your immune system at the same time you are taking Tysabri. Even if you use Tysabri alone to treat your MS, you can still get PML. Your risk of getting PML is higher if you have received Tysabri for a long time, especially for longer than 2 years, have received certain medicines that can weaken your immune system before you start receiving Tysabri, have been infected by the John Cunningham virus, JCV. Before or while you receive Tysabri, your doctor may do a blood test to check if you have been infected by JCV. JCV is a common virus that can cause PML in people who have weakened immune systems, such as people taking Tysabri. Your risk of getting PML is greatest if you have all 3 risk factors listed above. There may be other risk factors that have not yet been identified. Patients who are anti-JCV antibody negative are still at risk for the development of PML due to the potential for a new JCV infection or a false negative test result. Therefore, patients with a negative test result should be retested periodically. While you receive Tysabri, and for 6 months after you stop receiving Tysabri, it is important that you call your doctor right away if you have any new or worsening medical problems, such as problems with your thinking, eyesight, balance, or strength, weakness on one side of your body, and using your arms and legs that have lasted several days. Tell all of your doctors that you are getting treatment with Tysabri. Because of your risk of getting PML while you receive Tysabri, Tysabri is available only through a restricted distribution program called the Touch Prescribing Program. If you have PML or are allergic to Tysabri or any of its ingredients, you should not receive Tysabri. Before receiving Tysabri, it is important to tell your doctor if you have a medical condition that can weaken your immune system, such as HIV infection or AIDS, leukemia or lymphoma, organ transplant, or others, or if you have any new or worsening medical problems that have lasted several days. If you are pregnant or plan to become pregnant, or if you are breastfeeding or plan to breastfeed. It is not known if Tysabri can harm your unborn baby, or if the Tysabri that passes into your breast milk can harm your baby. About all of the medicines and supplements you take, especially medicines that can weaken your immune system. If you are not sure, ask your doctor. Tysabri can cause serious side effects. If you have any of the symptoms listed below, call your doctor right away. Herpes infections, increased risk of infection of the brain or the covering of your brain and spinal cord, encephalitis or meningitis caused by herpes viruses that may lead to death. Symptoms include sudden fever, severe headache, or confusion. Infection of the eye caused by herpes viruses, leading to blindness in some patients has occurred. Call your doctor if you have changes in vision, redness, or eye pain. Liver damage. Symptoms of liver damage include yellowing of the skin and eyes, jaundice, unusual darkening of the urine, nausea, feeling tired or weak, or vomiting. Allergic reactions. For example, hives, itching, trouble breathing, chest pain, dizziness, wheezing, chills, rash, nausea, flushing of skin, low blood pressure, including serious allergic reactions, for example, anaphylaxis. Serious allergic reactions usually happen within 2 hours of the start of the infusion, but they can happen any time after receiving Tysabri. Weakened immune system. Tysabri may increase your risk of getting an unusual or serious infection. The most common side effects of Tysabri are headache, urinary tract infection, lung infection, pain in your arms and legs, vaginitis, stomach area pain, feeling tired, joint pain, depression, diarrhea, rash, nose and throat infections, and nausea. If you experience any side effect that bothers you or does not go away, tell your doctor. These are not all the possible side effects of Tysabri. For more information, ask your doctor. To report side effects to FDA, please call 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, at tysabri.com. This information is not intended to replace discussions with your healthcare provider.